Tell us about yourselves.
I'm Danae Young, and I work for Heritage Home Health and Hospice. I have been with them 3.5 years now. I've actually been in healthcare marketing for 14 years. I was a pharmaceutical rep, and then I went to work for a different home health company before I came over to Heritage.
I'm Kelsie Hansen. I have done healthcare marketing for 4 years. I've been with Quinn, Meadows, Rehabilitation and Care for almost a year.
What do you enjoy most about the marketing position?
I love what I do because I feel like we really do make a difference in patients' lives. I think people think of marketing and it has a negative connotation. However, I look at it that I'm able to educate people on what it is that we're able to do. So therefore we can, increase their quality of life. And I feel like we really do have an impact on a patient and the community with what we do.
I love the relationships I build most of all. I have that with the physicians and with some other agencies, and then I also have that with our residents and our families, and I think that's a huge part of marketing because they need a safe place to go to kind of talk to, and it kind of continues the relationship, after they discharge from us, and then a lot of times they come back. So I love that part of it.
Yeah. So tell us what your definition of marketing is.
So I think mine is a little bit different than what most would think of marketing. I don't feel that I just go and promote something.
Okay.
I feel like the biggest component of what I do is education and teaching people about what home health and hospice is and how it can help them and how it can make their lives better. It surprises me when I started in this industry how little people really understand. And so that to me is what I really, really enjoy, is the ability to really help people and educate. And I think that education is a better word even than marketer.
It's got to be the education piece. A lot of people don't know what services are available. You come to skilled nursing, people think nursing home, which is not true. I think education is a huge component of it because people need to have a resource to bounce questions off of. And the second they have that, they come to you for a lot of things.
Why should a person go marketing? Why have a marketer? Why is it important to do marketing?
How else do you create a name for yourself in the community and for people to even know that you're there and what you do? So you need to go out. I call it littering the landscape, for lack of a better word, and that is taking educational brochures, pads of paper, pen, and making sure that you are going in, and not only are you educating them, but you're letting them educate you. Because we need to know, how do things run in different facilities? How do different physician offices work? How does the hospital work? So they need us to be able to go in and learn those things and be able to pass it on so that we can make sure that what we're doing is in accord with what each facility or each office would like us to do.
Marketing is a huge piece of what Danae said also. You have to have your name out there. If you don't have your name out there, people forget about it. And you think of things like commercials that you hear on TV, or you think of a flat tire and you know exactly where to go. You have to have your name out there. People will think of you as soon as they need you.
Why is it so important in healthcare?
There's a lot of choices out there.
Okay.
And there's a lot of people who aren't educated on what's available for them. So I don't know how many times I've had family and friends call me and say, so I have to have a knee replacement. I just go home and wing it, and I'm like, no, let me tell you what's available for you. And it doesn't matter where they live. They could live anywhere in the country, but they reach out to me because I can answer their questions. So people need to know that there's services available for them in healthcare that really will help them no matter their age. And I think that we do a disservice if we don't offer that and we're not out in the community giving that education.
I think people also need to know that they have options available because I get a lot, like I said, tours that'll say, I don't want to go to a nursing home. Well, the difference that sets Quinn apart from everything is that we aren't a nursing home. People need to be aware of that. They need to be aware that they don't have to stay there forever, that they don't even have to stay there for months at a time. It's a short-term thing until they're ready to go home and take care of themselves, and then we refer them out to home health, where home health steps in and takes care of them in their home. So,
do you find it important to plan your marketing ventures when you go out? Do you just kind of like, I think I'll go marketing today and just jump in your car, and start driving around town, or?
I chuckle at that because I mean, wouldn't it be nice if that could happen? No, I personally have myself on a 2-week rotation where I know where I'm going to be, if I'm going to be local or if I'm going to be out of town. And you really can't wing it. I mean, your day changes and fluctuates dramatically through the day as, you know, you get phone calls of things that need to happen, but you need to have an idea of where you're going and what your message is going to be for that day and have that planned out prior, because otherwise you go out looking really uneducated and unorganized and unprofessional, and that does not do anything positive for anybody.
Right.
A couple of pieces that go into mine for that. You have to be organized in my marketing because I have to know who's in the OR, who's in their office. I have to know kind of people's schedule. And another thing is I plan lunches. I have to know, and I have to be planning ahead of time to make sure I have enough food, to make sure that everyone can be at my lunch, or, you know, you have to be organized. There's no way to just wing it. There really isn't.
What tips would you have for someone who feels uncomfortable about visiting a physician's office? We ask our administrators to market, and you know, they aren't used to just walking into a physician's office. So how do you approach the receptionist? Kind of give us an idea of what that looks like.
I think people underestimate the value of humility. When you walk into an office, especially for the first time, you need to be very polite and professional with the receptionist. What I have learned in my years of marketing is that sometimes people have a tendency to overlook them and boss them around when they come in, and you know, they're your best source of information. They're telling you what's going on in the office, you know, who they're seeing, what days they're in the office. And so I would just go in and always play the new card if you've not been in before, because they're always a little kinder to someone who doesn't understand the ropes.
Right.
And you go in and you just ask a lot of questions, but you listen. You do a lot of listening, and you're really respectful to whoever's at the front, because that's what's considered the gatekeeper, and that's who's going to let you back into the office to speak with the staff and the physicians and the mid-levels. So you want to develop a good relationship with them. So it's just a lot of just being really kind and polite and listen, and it never hurts to take them a little bit of candy.
I think that you have to be so sincere when you go in. You have to be you, and be consistent. Don't make promises you can't keep. You know, you don't offer information that, you know, don't come in and flood them with information. Just be sincere. I think the biggest lesson I've learned, you know, watching other situations, they just don't like to be flooded like that. So being you, being consistent, knowing your place when you go there. I mean, you can't just go in and say, do you have a referral? Can I go back there? You know, that takes time.
That does.
You know, that takes a lot of time, and it takes a lot of relationship building. And I think people, you know, you show up consistently and they learn your name and you learn their name, and that goes a long way also. A kind smile and a first name, you have no idea how name recognition builds relationships. And I think that goes unnoticed a lot.
I think Kelsie speaks to something that a lot of people forget, is when we go in there the very first time you go in, remember that you're actually in there kind of selling yourself before they're going to really develop a trust in you. They need to know they can trust you. So when she says go in and be sincere and be who you are and be straightforward and honest, I think is some of the best words of advice that can be used. It is so important to be just who you are, because you're selling yourself first so they can develop that trust with you. Mm-hmm. Don't be a stick in the mud either. You have to have a good sense of humor.
Good.
And you have to be able to laugh at yourself, because you're going to go in and you're going to do some stupid things sometimes, and you're going to say something and then you're going to walk out and you're going to be like, why did I just say that or do that? And that's okay. Just embrace it and move to the next visit, and try not to fall all over yourself again, but you got to have a good sense of humor.
Okay.
Yeah.
Do you always feel comfortable when you go into an office? Like, oh, I am just so comfortable being in front of this.
I would say no. Nope.
I
Sure
definitely
don't.
would say no. There are times I go in and I may not even care for the person that I'm going to speak with.
Oh.
But you know, on a professional level, you need to go and do your job.
Right.
And so you go in and you take care of business.
Right. Yeah.
Yeah, you better edit that part out. I don't want anyone to know that I may not care for them.
I care for everyone.
I love everybody.
Person.
Everybody.
I want you to be really honest. Can
Okay.
anybody be a marketer? Can
No.
anybody do this?
No.
No, not
Okay.
everybody can be a marketer.
Okay.
I think there's a lot of attributes a marketer needs to have. Two of the biggest ones to me are you're somebody who's trustworthy, you are who you say you are, and B, you need to have thick skin. Because you're going to hear the word no a lot. You may find somebody on a bad day and you may be their whipping post because you're the person standing in front of them. And so I don't think just anybody can be a marketer, and it does take a specific something to really go out there and be effective. I think we can teach skills and you can teach the knowledge that is necessary
Okay.
for the field that they're in, but there are some very intrinsic traits that make a marketer a good one.
I think charisma goes a long way with marketing. You have to be warm and you have to be very receptive to a lot of information. You get a lot of feedback that you weren't really prepared to get. So you have to be very professional with that and very trustworthy. Like Danae said, it's a huge quality and people notice that. They'll pick that up really quickly if you're not trustworthy. But I think it takes a special person to be a marketer.
Do you always take something with you when you go out to visit someone?
I always have something in hand. I feel like if I go in there and I'm bringing something of value, when they see me, they realize this is Danae. Oh, okay, well, she's going to have something for me today. She's going to have a question about a patient. There's going to be something that's of value, so I'm not wasting their time. One thing that I have learned through my years of experience is they detest it if you're wasting their time because their time is money. So yes, I always have something in hand. I mean, you'd be surprised how far a pen and a pad of paper will get you, surprisingly enough, especially with the nurses. But always bring something of value. That's one thing that one of my biggest things is you always bring something of value every time you walk through the door of a clinic or a hospital or a facility, no matter where you go. Always bring something of value.
It's true. You don't necessarily always need to bring a treat or food. I think people get really hung up on that. Your business card is huge, huge ticket into meeting a lot of these people because they need your contact information. But I always do that with a pad of paper or a pen, or I've got different water bottles or coffee mugs. And I do treats as well, but I don't think a treat is necessary every single time. I'll take discharge summaries, anything that is, like Danae said, of value, because the time you spend back there, those minutes are numbered throughout the day. Those are very limited spaces. So.
Right.
And a trick that we've kind of learned, like she mentioned, taking discharge summaries. Sometimes if we find a physician we're having a hard time getting some paperwork signed, faxing it, and it's not coming back, I'll hand carry it.
Yeah.
So then that gives me even more credibility. Like, I'm here with this patient paperwork. I need to have it signed. This is what it is. This is what's going on with the patient. And it is yet another reason to be in their office and bringing something of value.
And educating again.
And they know that you have follow through.
Talk about educating even doctors' offices and the hospitals about what you do, because a lot of times even they don't know what you do, or they don't even know you exist. Say you're a brand new facility or something. So not only a gift would be important, but a piece of education about what you offer, right?
Correct. When I started at Heritage, we didn't have a lot of what I call them leave behinds.
Okay.
So brochures or slicks that talk about what we do. And so I developed some things based upon some feedback that I received when I was asking different offices, what is it that you would like to know? But when you go in, I mean, you always make the assumption that they don't know what you do, they don't know who you are. Okay? And you need to speak in terms that they can understand, because sometimes we have a tendency to use abbreviations or language that may not be familiar to everybody.
True. Yeah.
And so when I go in and I'm talking to somebody and I'm like, well, they'll need to go to a sniff. Well, what's a sniff?
Right.
And they don't understand. So we just need to make sure that we're talking in terms that they can understand, and being very open to questions and being prepared. I think, we get a lot of questions. What is it that you do? and just being really open to that. But being able to leave something when you go, your business card and something that has information about what you do, and encouraging them to call you if they have any questions.
I think a general awareness of what you do, a lot of people want to know, okay, well, what's the difference between skilled nursing and assisted living? So I think a general awareness is where I always start, because I think at that point it's an open door for communication, and they want to know, okay, so is it necessary for me to do skilled? Is it necessary for me to do assisted living? And I help people all the time who aren't coming to skilled nursing. They're actually going to go home with home health, but they need to know what their options are. And they need to have a portal to get that information. So I think knowing, kind of opening the door and just being open to a lot of questions that maybe you didn't realize would happen, but knowing what you're selling is the biggest thing. I think still, again, knowing your industry and kind of dumbing it down if you need to. Here's a basic acronym and here's what this means, because literally people don't know.
How do you handle it when you're out to talk about your wonderful company and someone has a negative story about your company and they have found someone to unload on you about something negative that happened at your place of business or with your place of business?
I think it's all in how you handle that.
Okay.
I believe knowledge is power, and if something has gone awry and maybe a mistake was made, if we know about it, we can fix it. If we don't know about it, we can't fix it. So it's a matter of asking questions and clarifying what exactly the complaint is, because sometimes people have a tendency to broaden and say, I had so many patients complain about you guys, but then when you really start asking questions, they had one person who had something negative to say. But I think it's a matter of learning what the situation was and follow through. What are you going to do about the problem? And then you need to get back to them in a timely manner to let them know what it is that you've done to correct whatever issue occurred. But it's just being open and knowing that it's going to happen. Again, that thick skin, and following through. And owning something if you've made the mistake. Let's not make up excuses. I think that kind of makes us look very unprofessional. And so you just own whatever mistakes you make, because we're all human and we all are going to make mistakes. And they've made mistakes before, so when you own it in a respectful way and have the follow through, I think it really diffuses the situation.
Right.
People want accountability across the board. I don't think they're looking for an excuse, and I don't think they want to hear an excuse, and I don't think they want to hear you blame either. So I think being accountable, and then always circle back. Get your facts straight. Again, don't blame, but get your facts straight and circle back. People want to know that the problem is handled, and they want to know that they're going to have a positive experience in the future.
A negative thing, can have a positive impact.
Right.
In all reality, when they see what your follow through is, and you really do care about what they have to say and what experiences their patients are having. And so it can turn around to be a really positive thing for you if you handle it correctly and you do have the accountability and the follow through.
And I think they want to see how your team handles it.
Yeah.
Because sometimes things will happen with nursing. It wasn't therapy, it wasn't anything else. Something happens with nursing, and they want to see how we handle that and tackle that as a team, not how I'm going to go blame this nurse, or
Right.
they don't care about that. They just want the problem solved. So, taking a bigger interest in the issue versus, going and blaming is huge. That's huge.
Tell us a story, each one of you, your own story about one of your marketing adventures that resulted either in a significant boost in business or positively impacted somebody's life.
Those are like two very different questions to me. There's ones that have had
Yeah,
a
they
really
are.
positive impact on someone's life that's really made me feel wonderful about what I do.
Okay.
I had a friend who had an aging aunt, and she was struggling at home by herself and falling a lot. And they were thinking, oh, we're going to have to move her in with us. We don't have anywhere to put her. We're going to have to sell our house. Not even thinking about the options that assisted living could bring to them. And I happened to run into her one day, and she started telling me the whole story. And I said, let's sit down and talk. Let me tell you what your options are. There are things that you can do to make this easier and put her in a social environment and where she would, do really well. So I had the opportunity to sit down with them and educate them, and she ended up moving into an assisted living facility and doing really well there. She passed away, and I got the kindest note from her family thanking me for taking the time to visit with them. And that's really what it's about, is just taking a little bit of time to help somebody, to educate them, tell them what their choices are, so they don't feel so trapped. I think, healthcare in this day and age is really hard to navigate, and it's nice to know that there's people on your side.
I have a situation that's still pretty current right now at Quinn Meadows. So I've got a gentleman there, the hospital wasn't very kind when they sent us his information. They said, he and his wife should both go to assisted living, and perhaps he should go on hospice. And I kind of took the opportunity to maybe take it a step further and go up and talk to this family and see, if I could be any assistance for these people, if they want to know information about assisted living, or if they need to know what options are available for hospice even. So I went up there and realized this gentleman wasn't what the hospital had painted. And he actually has been at Quinn Meadows for a little while and is doing really, really well there. And his son came the weekend of Labor Day, and he actually cried. He said, if you hadn't taken the time to visit with my family, we wouldn't have known that he had the chance to be better and be successful. And he will actually discharge home with Heritage Home Health, and they're going to do really well. So I think you have to use your good judgment, go make your own assessment of things, but taking the time to be with people is what you need to do.
Yep. Boosting business, the one caveat that I have is I have been able to put in place preferred provider agreements for Heritage Home Health with some of the busier physicians, and specifically the orthopedic surgeons. And what that boils down to is that I was able to demonstrate to them that we had the right team. I like to say that the right people are in the right seat on the bus, and that we can have the best outcomes for their patients. And being held accountable. By being held accountable and knowing if I get a phone call saying, I need you in my office now, I have to talk to you. I go up there, I take care of whatever's going on. And by doing that and proving that, we will take the best care of their patients, I was able then to get these preferred provider agreements, which has really impacted our business and boosted the business from those 3 orthopedic surgeons.
But I have found that making life easier for case managers, because that is our biggest referral source. They want to pick up the phone and call me and know I will do it. So that has been a huge helper for me. They have a direct number, and they know that I'm going to take care of it when they call. If I need a prior authorization, if they have questions, if they need me to meet with a family, I will be there. And I think making it easier for people is what they want from me. So that's what I've focused on.
There's a common theme, I think, that runs through all of these questions and our answers, and that is that you're going to be held accountable and have follow through. And I think there's a common underlying theme to all of these answers. Follow through. It's more, marketing is more than just going out and leaving stuff and having a few words to say, but following through.
And consistently following through every single time.
I know you have some secrets up your sleeve about being a successful marketer. Would you be willing to share at least one of them?
I don't know if there's really a secret.
Okay.
I think that, to me, if you want to call it a secret, is be the real you. I will visit with these offices, and other marketers come in and they're fake and they're loud and they're pushy, and they see right through them. And although they may not say something directly to them, I hear about it when I'm being told, thank you. Thank you for not being like that. So I think that is the secret to being successful. Be you.
I don't know if my secret is necessarily a secret or if it's going to help anyone, but I think that my heart and my passion are in line, and I think that's a huge key component here, because it helps me to do my job appropriately, to be real, to be authentic, to be trustworthy, because just like Danae said, they will walk away because they see right through you. But I think that the biggest piece of advice I have is to make sure that your passion and your heart are in line when you go out and sell your company.
To always be respectful of the patient. If you're going into facilities, into physician offices, like if I'm waiting at the receptionist desk and a patient walks in, I step away and I let that patient check in, and they take care of the patient first. So I think it's really important, if you're going and making calls, to be respectful of the patient. That's what I mean, granted, we're in the business of taking care of patients, but remembering that they come first.
So I think the important thing to remember too is that when you're not marketing, you're actually still marketing. I can't tell you how many times I've gone into my kids' school and they're like, oh my gosh, do you remember me? I was at your facility because my grandma's there or my aunt's there and I was visiting. Do you remember? And because I'm affiliated with Quinn, you have to always kind of watch what you're doing because you're always marketing even when you're not marketing. You know, I have this jacket that I wear around. It's Quinn Meadows jacket. I'm not at work, but I'm still wearing my jacket because I like my jacket. So even when you're not on the clock, you are still the face of that organization. And
As a marketer, I mean, what is your role to your staff, to the staff that work for your company? Do you have a role as a marketer with the staff?
I actually sit down with the staff quarterly because I like to remind them that they also are marketers in their own ways, because how they treat people, how effective they are in their job comes around and can either help us or hinder us. And so we sit down and we talk about that. The other thing is if they're struggling getting something that they need from a physician, they also know that they can reach out to me, and I will make a phone call, I'll run into an office, help get the paperwork, whatever's necessary. But also, if they just need somebody to vent to, I have learned that sometimes you just need to be that person because you're not clinical. They want someone that's just outside of the picture that they can call and just vent to, and then it's done, and not have to worry about anything else impacting their job negatively. I call it the safe zone, is what I call it.
so we call it internal marketing, but it's the exact same thing. They don't want to go to the administrator with things. They don't want to go to the director of nursing with things. They need someone who just understands the big picture and can maybe just be a safe spot or, you know, be a shoulder to cry on. I have people who will occasionally, shows in their work performance, maybe they're struggling at home and they just need 2 minutes of your time and for you to just remind them why they're still with Quinn Meadows, because they make a difference. And I think that when you show that you care about your staff, it in turn, they provide better care for other people because they know that they're also cared for.
This is why you're important. It's always nice to know that you're needed and you're important, and sometimes our job is to remind them of that.
Yes.
It's a pretty thankless job at times. I mean, I think healthcare is fairly thankless, and we kind of have to be that for each other.
We definitely do.
I think that's part of internal marketing because it keeps your staff strong, helps you find joy in your journey, you know?
Yeah.
Oh,
Yeah.
she got it.
She got it.